Hi, my name is Dr. Keith Lewis, and welcome to my site. You're watching this video because you, someone you know, and maybe even someone you love, is experiencing a thyroid problem, and more specifically, a low-functioning thyroid or hypothyroidism. Surprisingly enough, 47 million Americans in the U.S. today are experiencing hypothyroidism, and many of those people don't even know it. They just have the symptoms of it. I'm going to offer you a free thyroid report today. All you have to do is fill out the contact information below on this page, and we'll send you the report right out. So why is the report so important? So what's so great about this free thyroid report? Well, there's information in this report that I'm sure you've never even heard before. The most common symptoms of thyroid problems, as you probably know because you're watching this video, is fatigue. You're tired all the time. You go to bed tired, you go to sleep tired, you wake up tired, you're so tired you can't function through the course of your day. Another common symptom we see typically is thinning of the hair. Many patients come to us with that as their primary complaint. Other symptoms of thyroid may be digestive problems. Many of our patients have indigestion, they have heartburn, acid reflux problems, bloating. A real common problem we see is constipation. Often patients come to me and say, Dr. Lewis, I have a bowel movement once a week, or I have a bowel movement once every 2 weeks. I've even had patients tell me they have a bowel movement once every month. If you can imagine that. That in itself would make you feel absolutely miserable. And as a tidbit of information, did you know that your gastrointestinal system, your gut, your GI tract actually consumes more energy than any other organ system in your body? Another contributor to fatigue. So anyway, other information that you may not be familiar with, just to mention a few. One is the thyroid and its relationship to diabetes. Do you realize the thyroid gland and thyroid metabolism has a direct effect on blood sugar levels and blood sugar metabolism? Most people don't even realize that. So a lot of patients we see, again, they come in, they've got these stubborn blood sugar problems or diabetes problems they can't control with diet or exercise or even with medication. Until we find out and discover they truly do have a thyroid problem, do we finally get to the bottom of why they can't control their blood sugar. Other problems that we see, and you may not be aware of, is that thyroid has a direct effect on blood fats, cholesterol, triglycerides. How many people, maybe even you, have experienced problems in terms of trying to get your cholesterol, triglycerides in check, even taking cholesterol-lowering medications to no avail? Well, oftentimes it's an underfunctioning thyroid. That's the primary reason why. Another common complaint that we see, and not just a symptom or a diagnosis, is a complaint from our thyroid patients, is that they've been to the family doctor, they've been to the endocrinologist, and the doctor tells them, well, you're just depressed. And the patient looks at the doctor as if, I'm not depressed, but they put them on antidepressive medications. And many of these patients, go ahead and try it. They try the medication. One medication after another, and the result, they feel horrible after taking these antidepressive medications. But what would you expect? The patient's not depressed in the first place. Interestingly enough, there was a recent journal article published several months ago reviewing the use of antidepressive medications for mild to moderate depression. And they were found to be very, very ineffective. And the conclusion of that report was basically this, was that there may be other underlying causes of this diagnosed depression symptomatology other than depression itself. So again, maybe it's an underlying thyroid problem. So the report contains a lot of good information, new information, current information that's in the medical literature that many of you probably have never even heard of. We're also going to discuss laboratory work, laboratory findings, and many times I have patients come to me and they are so frustrated. They've been to the family physician or they've been to the endocrinologist and they've had some laboratory work done, and they were told, your labs are normal, there's nothing wrong with you, even though you have XYZ symptom of hypothyroidism. That's alone, I think, it makes my patients somewhat depressed when I first start seeing them because of their frustration levels. But most doctors perform a TSH, thyroid stimulating hormone test, and based on that test alone, it's determined whether or not you have low functioning thyroid or a normal functioning thyroid. And unfortunately, that really isn't enough of a test to really paint the picture as to how the thyroid gland is actually functioning. Some doctors go as far as doing a T4 test, and again, not enough information. There's a complete thyroid panel that we perform in our office that really gives us a crystal clear picture as to how that gland is functioning or not. And without those tests, you really don't know. So again, there's a lot of truth in numbers, and I really believe that the diagnostic testing that we perform is superior to any, just simply because we're doing all the tests that are necessary to thoroughly and completely diagnose a particular condition. So anyway, the report's very, very thorough, a lot of good information, and I really believe that the information you're going to be reading in this report is actually going to be life-changing. And certainly you're going to learn a lot of information that you don't already know. So if you're interested in taking charge of your health, if you're interested in changing your life, do something right now. Fill out the information in the contact part of this form on this page and send it to us, and we'll certainly make sure you get the free thyroid report. Thank you. This is Dr. Keith Lewis.